The rise in medical costs have become a daunting reality for millions. According to the World Health Organization, last year alone, Nigeria's healthcare expenditure skyrocketed to about 7.3 trillion naira, with 77% of medical expenses borne out of pocket. The National Bureau of Statistics of the 2023 report said that 45% of Nigerians struggle to access healthcare due to the high cost. So today we are, of course, going to dissect the surge in healthcare service costs and the way forward. We have in the studio, joining us is Dr. Shamsudeen Ahmed Aliyu. He's the MD CEO of Foresight Premier Hospital, Abuja, also the Vice Chairman of Sahad Hospital. Good morning, Doctor.
Good morning. Good to have me.
Of course. Thank you so much for joining us this morning. So, Doctor, let's talk about this high costs of medication happening in Nigeria. What are the key factors, just plummeting and increasing the significant increase in medications in Nigeria?
Well, the rising cost of healthcare is multifactorial. There are so many issues interlinked together to create this complex situation we're in right now. Of course, I'll begin by mentioning inflation. Inflation is really the major cost of this. And in Nigerian healthcare system, very few things we use in healthcare that are manufactured in Nigeria. So we have to depend on imports. And the naira has been depreciated, and a lot of equipment and consumables are coming into the country at a very high cost. So the hospital has to increase the pricing, which increase significantly the inequality in accessing healthcare. Another reason is aging population. When you have aging population, of course, there is high demands in healthcare within those communities because of the growing number of chronic diseases like hypertension, diabetes. They will be visiting the hospital frequently. That's on individual level, it increased the cost of healthcare.
So increased demand.
Demands in those people. And again, debilitating primary healthcare in Nigeria has contributed a lot. We have a very good system in Nigeria, primary, secondary, and tertiary care. So if diseases are diagnosed early at the level of primary care and fewer medications are used, there's no need for high-end medical equipment in diagnosing those diseases because it's at early stage. Then you will find out that the cost of healthcare will reduce. But because our primary healthcare are debilitated, then it discourages people from going to the hospital. Imagine you have local governments and also the primary healthcare in those local governments are not good, and they have to travel to city to come to the tertiary healthcare. It discourages them. So they keep nursing the disease at home. It was small, and then it keeps increasing until it becomes unbearable. That is when they are not talking about going to a primary care or secondary care. They're going to the tertiary care. At that level, there's a high number of tests, investigations that they'll be asked to do, and then it's voluminously increased the cost of care they are receiving. I can go on and on and on. There are so many factors that interlink together and increase this.
Yeah, but there's a lot of clarity in, at least we know. Before we're just holding on to inflation, but now we are knowing there's, different parts of the cost of, the increment.
Yeah, but in addition to this, I love the fact that you've broken it down categorically, giving us why there's a cost from inflation to importation, devaluation of the naira, and attitude of people, and also, which also plays a role on the fault of access to primary health care.
Yeah.
But there's been a certain level of, accusation towards private medical practices and their attitude towards exploiting patients. We know the state of both the primary and the federal and state healthcare facilities. So most of the time, people tend to turn to private medical practitioners. And like you've rightly stated, most of this equipment are imported. But is there a likelihood that it could be a lot more affordable for Nigerians with the current Nigeria we're facing today?
It's not likely. So this impression that people have, I think it could be like, how do I call it? When you're trying to say there's exploitation in the private sector, a lot of time is not what people think. Now, you have teaching hospitals or government hospital, for example, that entirely does not depend on the revenue they generated to be able to take care of themselves. They undermine the cost of healthcare. The reason is they don't care if they do certain tests for 2,000 naira or 500 naira because their salaries does not depend on that. Their demands in the hospital provisions of all the equipment are budgeted through the Federal Ministry of Health. They don't care about how much they are generating. They don't depend on that. But when you talk about private healthcare system, they will have to cost everything. If I buy this reagent for the lab, 200,000 naira, for example, and I'm only able to do 100 tests with this, I have to cost it. I have to the barest decimal that if I do the test less than 2,000 naira, I'm not going to make anything. And when you look at the government hospital, this is not the analysis they do when they are trying to come up with the prices.
How do they analyze it?
There's no such analysis because no, they don't depend on that. Whether the hospital generates tons of money or no money, the staff will still get their salaries and everything will go according to what it is because government doesn't depend on that. But when you look at the private sector, they depend on their revenue to be able to pay their salaries and to also afford other medical.
Yeah. So I get
I'll give
your
you
defense.
an example now.
Doctor, I get your defense on the private sector on why things can be expensive on the private level.
Yes.
There is no government backing. This is just
nothing.
an individual or group of people having, a way of their business.
Yes.
But then there is this saying around, we all know Nigerians are saying it, feeling that there is a deliberate effort of making the federal, the government hospitals fail and healthcare centers because we know some people are benefiting from the private sector. How true is that?
It's not very clear what you're trying to.
People are saying that they are leaving the government hospitals and healthcare facilities to, be in a deplorable stage.
Yes.
But then we know a lot of doctors own their own private hospitals. And most times you go there and someone would divert you and say, oh, go to here to see this. So people are thinking it's a deliberate effort to ruin government facilities because of some few individuals to benefit when it comes to the private sector.
I'm not going to depend the private sector in this. Maybe some people are doing something like that who are working in the government institution as well. They are owning their private sector, private hospital. I cannot depend that. It could be happening. But in the majority of cases, it just have to come down on how they are assessing their own equipment and consumable, and they have to do cost-benefit analysis to make sure that if I do this test at this level, I'm not going to get anything.
Yeah.
Because everything they do depends on what they generated.
All right, doctor. You're a doctor, right?
Yeah, yes.
How do based on your relationship with patient around,
yes.
how would you say that the cost of living has impacted on Nigerians, an average Nigerians?
Well, it's actually unthinkable because when you look at some people's salary income or earn and the cost of living, you will be imagining how they are even surviving. Because up to now in Nigeria, especially in the private sector, people are earning less than 50,000 a month. And from what we know, that 50,000 cannot actually take anyone a month. So, and this situation is really worsening by the day. This is continue to affect people because every single day you wake up, you go to the market, The things you buy 5,000 yesterday, you find out it's going to be 7,000 or 8,000. And the income are kind of static. It's not increasing. So it's really something that is unthinkable and is unimaginable.
So how is this affecting the surge of people who are ready to access healthcare? So far in your experience, how is this affecting people? We've established the fact that cost of living is really hampering people.
Yes.
And if people can't eat, what's the guarantee they would want to buy medication? Because of how expensive it is, that's one. And sorry, it's a two-in-one question.
Yeah.
And secondly, as private sectors, how can you strike a balance with the public sector to give accessible and affordable healthcare?
So number one, I made mention healthcare inequality. Because of the high cost, the people that has low income are discouraged from going to the hospitals. So definitely they will have to make a choice whether to eat or to use this money to access healthcare. I am having this conversation with somebody highly placed in the Ministry of Health about malaria treatment in Abuja here can cost up to 20,000, 30,000. He says, no, I have just received care in malaria and it cost me 49,000 naira. So which is somebody's entire monthly salary, somebody with a wife and maybe 2 kids or even more than that. So this high cost has really increased the healthcare inequality. People cannot access healthcare. People that are of low income position cannot access healthcare. The striking the balance between private and government care is really very difficult. The reason I've made it very clear, the private sector depends on what they generated. I can give you an example with my own healthcare facility.
Go ahead.
In Sahad Hospital, I have about 239 staff. And my salary last month alone is 49 million naira. And my entire revenue was not up to 60 million in that particular month. So where is the money coming in to buy other consumables to use if you've taken 49 out of 60 million to pay for your salary? You cannot be able to strike a balance between government and private sector, because every single day you'll be looking at, okay, what I'm getting, is it going to be enough? Is it going to be enough? So doing business in Nigeria is very difficult. There's no incentives from the government. There's no program that support. To mention that what I told you last month, I paid 14.9 million for my electricity in my hospital last month.
Electricity is another
So think of all of this, that the private sector has to keep thinking of how to balance this and that, and then the costs.
Yeah.
So it is very difficult. Government definitely has to come in. One, as Ahmed mentioned, to bridge this gap is to improve primary care.
Yeah, because initially, right,
yes.
Doctor, initially we know that private hospitals are for the elites.
Yes.
You know, you have to be able to afford
Yes.
it to go there.
Yes.
But then what is being done for the people that
Yes.
cannot afford it?
Yes.
So, yes, let's come back. I mean, you've well defended the private sector. Let's come back to the public sector and all of that.
Yeah.
There is the NHIS. We're talking about the National Healthcare, insurance scheme happening. But then a lot of even people, the civil servant, people that work, do not even know that they have this insurance. And even when you know and you want to make use of it, there is a lot of limitations.
Yes.
They will tell you, you cannot use this surgery. It doesn't cover this surgery. It doesn't cover this drugs. It doesn't cover this. And now with each day passing, the restriction keeps getting more stricter.
Yeah.
So what is your take on that, and how can the government handle that situation to make life easy for an average Nigerian?
So you see, the primary health, the national healthcare insurance coverage at the moment is not even up to 10% of the entire population. That's very sad. So
we still have a long way to go.
We have a very, very long way to go to achieve the universal health coverage. And that made people to be buying things out of pocket in healthcare. So what I can say is, one, the government needs to increase the level of coverage in the NHIS. Even the public sector, not all of them are completely assessing the care. And also what you're saying is true, that there's certain limitation on certain things are not covered, certain things are covered. And also the facilities too, what they are receiving from the NHIS is quite low. It's a struggle for you to keep up, because it will be sad to know that the NHIS is paying each facility 750 naira per head for the people that are going to that. So let's say you come to the hospital to access care. What I'm receiving per month on your behalf from NHIS is 750 naira. Even the paper bag that I'm putting your medication is now, we're buying it at 500 naira per bag. So what about the medication and the tests you have to do? Despite the fact that there is a secondary care and primary care, but the level of primary care that you are assessing realistically will cost a hospital more than 10,000 naira.
So what is the NHIS covering then?
So there is a primary care which NHIS covers, like the basic care. Antenatal care is part of the primary care. The basic consultation with the doctor, basic laboratory tests, basic pharmaceutical drug, they are all covered under this 750 naira. So when any person comes. So if person requires advanced care, like surgeries, like ultrasound, X-ray, then the NHIS will pay separately for those ones. So even at that, there is a guide on what they can actually pay. It's not actually what you are providing for a private patient if they come. It's actually a reduced form. So it's a necessity for the hospitals to accept that, because other people might be able to come to access the care. But when you're talking about profitability in business, it's not there.
Yeah.
For me, sitting at the facility end, that I am care provider, I know what we struggle on. And apart from that, the HMOs that are paying the secondary, because NHS is not paying directly to the hospital for the secondary care, they are paying through the HMOs. There's also delay payment. Some are delaying payment for 3 months. You've not received that. So this has actually complicated the way private sector operates, and that will increase what you are suspecting, that how they can actually undermine the public institution just to survive. Because you have the cost to bear at the end of the month, the salary, the energy, and the consumables for your running of the hospital, otherwise it's shut down. And then there's a delay payment, there's underpayments. So what I'm saying in the whole sense is a lot.
Yeah, doctor, you seem to be saying a lot as a shocker for Lillian.
Yes.
Yes. I had experience with this.
This is a reality.
I realized that there's a certain level of attitude of private hospital facilities towards people who come with HMOs and NHIS registration. And I never really understood why till he has broken it down now, saying that there is underpayment. I only heard of they don't pay us, or this HMO will not pay us in time. But I would love you to throw more light on this, especially when it comes to, we know how important maternal care is in Nigeria and how we're going towards the goal of earning maternal mortality in the country. And it's very important that we have women to have access to maternal care in qualified hospital with qualified healthcare practitioners. What role does the NHIS and HMO play towards maternal care? CS in certain hospitals, cesarean section is going from, I know there used to be a flat rate of 90,000, but it's going to 300, 400, half a million for somebody to go for cesarean section, be it emergency or planned. So what role are these HMOs and NHIS playing, towards maternal care that it claims to be a priority?
So, as I said, antenatal is covered under primary care in NHIS, and then cesarean section is covered under the secondary care, which HMOs pays. So only that certain hospital doesn't accept the terms from NHIS. That's why you can't go to those hospitals. because the pay they are receiving from NHIS is not to what they're expecting. But of course, if you are assessing care in the government institution, these are all covered. And some private hospital too accept that, depending on their level. Because you understand that even in the private care, there is no uniformity in terms of how people are paying. Somebody is working in the smaller private institution, their salary is lower than those people working in the Zamia and stuff. So this high pay demands this hospital to have to charge high. Because if they don't, they will not be able to keep up. But those also that might accept the NHIS stuff is because even at the level of paying, they are paying their staff lower. Or some hospital outside capital territory, they are paying their staff. Okay, you're paying a nurse 60,000 naira, and in Abuja you're paying a nurse 150,000 naira. So you can understand why disparity is
Doctor,
there even among private schools.
Now what you're telling us is, even though the government would come out with initiatives saying there is a healthcare problem that we need to find solution to, like Lillian pointed, the maternal death rate and all of that we're trying to avoid. But then there is no plan strictly put in place for it, because now we're realizing that even the NHIS structure is not really good and clear enough.
It is not covered, unfortunately, what we expect it to do.
It's not adjusting to the reality of
discussions like this are really important, because we get to understand where problems are. There is a lot of loopholes, and just like you mentioned already, we know the primary health care in Nigeria is nothing to write home about. I was talking about even a federal medical center that I saw, and I was like, I cannot believe this is a federal owned. Then imagine a state government, then imagine at the local level, which is a primary healthcare. So there is a lot that needs to be done. But doctor, from your own side, what do you think? Where should the government start? Because there seems to be a very lackadaisic, reluctant attitude when it comes to our healthcare, considering that we are seeing it like on an everyday basis. We are not seeing any improvement.
Okay, so we're going in cycle, because the first thing the government need to do is to improve primary care. I will say it 10 times before I say anything. Because if the primary care is improved, those people from periphery doesn't need to actually come to the capitals, to the state capital, to access care. They will just walk in. The care is going to be really, the cost is going to be small. Because they can just walk in with just something on your leg, and then they treat you. Later it becomes a cancer because you didn't go. Oh, I have to go to the state capital, and it's like 200 kilometers.
Okay, so
if the primary care is improved, then the tertiary care and secondary care will not be overloaded. The reduced quality care in the tertiary institution is because it's overloaded. Because those that need to be in the primary care, they find their way in the tertiary care.
So what about costs of medications then?
So now, if we do that, I know government has initiative under the presidency for unlocking the healthcare value chains, which will improve the manufacturing in Nigeria. So when we have these manufacturing plants in Nigeria for equipment and also for drugs, that will reduce the cost, because we are dependent highly on dollar to do all what we're doing. Everything you do, you have to do the exchange rate. But if governments can support businesses, and then we have more manufacturing industries that will come in and then be producing our medications here, and the necessary equipment we need in Nigeria, it will waive the demands for the dollar, and the care will a little bit go down.
Do you see political will in this happening?
Well, Ahmed mentioned there is this initiative that I heard about, and I think I have a privilege of sitting with the coordinator to discuss what they are planning to do to help private businesses to improve and to also be able to manufacture medications here and other highly demanded medical equipment. So I think there's a political will, but the strategy, I don't have much information about it. But if that goes well, I am sure that would go a long way in helping. The primary health care has improved, and also we are manufacturing some of what we needed in Nigeria. It will reduce our demands.
But before then, Nigerians would still have to continue to struggle with the cost.
Unfortunately,
that is what is breaking my heart.
Unfortunately, that is what it is, because this is something that we don't expect to happen in a year. Although primary cares with political will, I'm sure is something that the government can do. We already have over 3,000 primary health cares in Nigeria. Some are in the state of Sori. All we need to do is to rehabilitate them.
What about brain drain, the availability of doctors for these hospitals, quickly before we go?
So which hospital are you talking about?
Both the primary health care and, the private hospital, we know they have access to these good doctors.
So the primary health care, actually, there are programs for the primary health care. These health technologies are producing people that has healthcare extension work. They are called doctors where there are no doctors.
Okay.
They are supposed to be working in dispensary, attending to that low level of care. Okay. They will be the one to say, okay, you need to see a doctor. And then they will send you to a secondary care, which is owned by the state government. Okay. Which I suppose each local government should have at least one general hospital. We have a good system if we can follow that. The local government are taking care of dispensaries. The primary care are already at that level.
I do not even want to seem as if I'm attacking general hospitals, doctor. That's a topic for another day.
Yes. So this is how it goes.
Okay.
So there's a structure.
There's a structure. All we need to follow them. From there, the primary is sent to secondary care, and they can take care of a lot.
We hope that this picture that you're painting, the right stakeholders get to take it and work with it, and we get to see where Nigerians will not complain about healthcare, because it's one of the basic amenities. Thank you so much for joining us this morning, Dr. Shamsudeen Ahmed Aliyu. I appreciate you, truly.
Thank you very much.
All right, with that, we wrap up this segment on Daybreak, talking about the health care services and even the sector in general.